It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We're also podcasting now, so you can pull us down off of any of the podcasting apps. And we ask you, when you pull us down, please like us, give us a review, and recommend us. If this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. How do they do that? Not by listening to me, but to these extraordinary guests that I get to come to the show. And today is no different. A big shout out to Cameron Svensson. He's the one that recommended these two guests to be here on the show. So I'm really pleased to have Laura Ellis. She is the clinical director and co-owner of Eminence Medical Clinic. And she's here with her colleague and co-owner, Leah Echeverri, and she is a nurse practitioner and co-owner too of this practice called Eminence Medical Clinic. And I am just so eager to learn about you guys. I mean, you came very highly recommended. So why don't I start with you, Laura? Tell us a little bit about the work that you do, who you are, how long you've been around. Actually, better yet, I would really like to learn a little bit about you and, where you're from and how you got into this space. If you could just educate and enlighten us, that would be awesome. And by the way, you can pull that mic to get a little closer to you if you want.
Should be okay.
Okay. So take it away, Laura.
Okay, so I'm Laura. Thank you so much for having us on today. We're very excited to just share everything that we can with you guys and all of the listeners. Eminence came about, I'll let Leah go into a little more about this too, but Eminence came about 5 or so years ago, and it's really just taken off and branched off, and we've really had the privilege of getting to service multiple patients across all of Maricopa County.
So real quickly, 5 years ago, pre-COVID or after? Or during?
I guess
it was pre.
Pre, right before COVID.
Yeah.
Wow, I'm sure you guys have some stories.
It was very different. Very, very different of what we experience and continue to experience.
Wow. What a little bit about your background. Tell me how you chose this space. Were you in the healthcare field prior? And
so I'm actually speech therapy prior to this, and
nice.
Then after working in the schools for a long time, I branched off and started doing home health, and then from there, that's where I was introduced to different aspects of who and what can go into the home to help out patients of all ages and abilities, and that's kind of where this took off as well.
And Leah, I'm just meeting you, and a little bit about your background and how you came about with Eminence, and really how the two of you guys got together. I mean, I've got L squared here.
Yeah.
I've got I got Laura and I got Leah. L squared.
Typically my background, I've always had emergency medicine. I've always been hospital based, and then I grew out as far as working in the outpatient world, learning more about the outpatient population. Very different from inpatient. Typically when we started about 5 years ago, we were a private pay. So it was very different. And now typically we still see both as far as private pay and insurance, but how we became about was actually from my son. My son is special needs. He's autistic.
Mm-hmm.
So I found it very difficult to go see doctors in the clinic or in their office. It was very traumatic for him, and then very traumatic for me. So, I ended up meeting her through mutual people, and then we started talking about what we did for work, and then she shared her experiences, I shared mine, and then along with my son's disability, and then we came up with a thing as far as opening up our services, not just to in-clinic patients, but for the people that can't leave their homes.
Right. No, you saw a problem you want to solve.
Yes.
And that's really cool. And the two of you guys got introduced through a mutual friend.
Yes.
So you've really only known each other for 5 years, or did you guys know each other a little before that?
Before that, I'd say It's hard to say how long though. Time flies.
Yeah, it does fly.
Yeah.
And I will tell you, having been in your similar shoes with partnerships, how's it going 5 years later? You guys still getting along? You having are you having backyard barbecues?
We still are.
I don't barbecue. She does.
Actually, it's been really fun growing, not just as a business, but together as
Right.
well. We're constantly learning about each other. So it's basically like a marriage, right?
No doubt. It's a business marriage for sure.
Definitely. So, I mean, we've learned so many different things just to be able to do better for the people out there as well.
So tell me, Leah and Laura, you guys came together and you saw a problem and you said, hey, let's do this together. I really, did you meet like in a bagel shop or at a coffee shop, or did you meet a church where you had this discussion? I mean, how did, you had friends bring you together, but I am always interested in entrepreneurship and really how people came together. So
I'll answer that. So, we were just talking before we went on as far as music goes.
Right.
I'm bad at music as far as naming who the band is. We actually met at a local bar with people. Who was the group that was actually playing? I don't even know, but it was there was a bunch of bands playing that night, and then we got introduced, and then we just started talking about what we did for work, and then from then on, it was just we started talking more and more as far as like what needed to be done, because there are a lot of empty promises out there, especially when it comes to medicine. They'll tell you, yeah, come here, but then unfortunately things get broken. There's always something missing. So we really wanted to come up with a plan that actually works and follow through.
And you did. And
so far, so good.
So and the name Eminence, I love that. How did that come to be?
So I actually thought of that name partially from The Who, but also then we were just thinking of names, and I wanted something that stood out, but I also wanted something that meant something.
Yeah.
So, I mean, the meaning of eminence is to be at the highest level. And
Right.
so everybody can, call themselves just what's something that's easy to remember. Eminence may not be that easy to remember, but eventually it will be because of what we do and how we do it.
All right, so I know we only have a couple minutes in this first segment. Describe for me and our listeners what Eminence Medical Clinic does mean. What do you guys do?
For us, it means that we do go above and beyond for our patient care. We are really big on communicating with our family and everybody who's involved with that care. So we don't pass the buck to anybody else. We want to make sure it's all done ourselves. If that means that we get, home health involved, we get nursing for them, or physical therapy, occupational therapy in the homes. We get caregivers involved if the patient is requesting that and has the ability to do so. We talk to patients even if they go back to the hospital. We speak with caregivers in the hospital,
Thank you.
and make sure that everybody is on board for when that patient is discharging. That way when a patient gets back home, everything is already set up for them. So that way there's not a lapse in care. There's, weeks don't go by that they're saying, well, I'm still waiting on home health and I'm still waiting on this. But instead we know, okay, they're being discharged on Tuesday. Home health is going to be there either on Tuesday or first thing on Wednesday. They have a plan set up. They know what's going on. Don't worry. You get to come home from the hospital and know that everything's just taken care of.
No, I love that. I mean, it's concierge. I mean, it really is. It's delivering care in the home. And if they're not in the home and they're in acute and post-acute setting, you'll go visit them there, which is really awesome.
We do. We take that extra step.
And you're coordinating the additional care, obviously,
Yes.
the home health or home care or hospice or whatever the
Even
need
with
is.
the social workers in the hospital, if they get admitted, we take that extra step to follow through. Not a lot of people do, but we go that extra mile. Or, for example, there's patients out here that their loved ones are out of state. We go that extra mile to make sure that we're taking that extra step to follow through with grandma, aunt, and whoever else, so everyone gets that full circle. We wear the different hats.
Right. And you know what the crazy thing is, and our listeners don't know this, you can do pretty much everything in the home.
100%.
So I would imagine you have relationships with diagnostic companies,
Yes.
whether it be X-ray or whether it be dental or any of those type of visits that happen at the home.
Yes, we definitely do. And we're able to bring in a lot of people to the home.
That's amazing. It
So
really
now
is.
with our company too, we're a little bit different too, to where everything that can be performed in clinic, we can also do to your home. For example, if grandma fell, took a slip, she needs sutures for that particular moment, we'll get somebody out there to take care of that. We're trying to prevent a lot of hospital visits or ER visits.
Readmissions.
Yep, readmissions. At the same time, we want to just have patients be comfortable at the comfort of their home. They heal a lot faster, right? Emotionally and physically, just being able to be staying at home.
And by the way, that's where they want to be.
Exactly.
Do you hear the music? I know, Leah, you don't know this one. This is The Who. Eminence Front.
Let me see.
Laura, right?
Yes.
Yeah, there you go. It doesn't get any better than this. My wife, Susie, loves The Who. And this is one of our favorite songs. So it was really special for me to get you guys to come in here today.
It was meant to be.
Just your name. It is meant to be. But we got a lot more to talk about. We're down one segment. We got 3 more to go. We've got Laura and Leah here. They're from Eminence Medical Clinic. They do home visits, and I want to learn a lot more, and I know you do too. So stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And if you're just tuning in, we're in our second segment here. And I am pleased to have in the studio with me, I got Laura Ellis here. She's the clinical director and co-owner of Eminence Medical Clinic. And I've got Leah Echeverri. Echeverri, thank you. And she is a nurse practitioner and also a co-owner. You guys are co-founders. You guys have been around 5 years. We talked about in the first segment how you guys really came together, learned a little bit about your background. By the way, my daughter's a speech therapist.
Oh.
That's a big shout out to speech therapy.
Perfect.
So you and I can talk offline. We can talk about her experience. And I love that you're a nurse practitioner. I want my other daughter, who is a nurse. She's a labor and delivery nurse in LA at Cedar Sinai, and would love for her to go on for further education. But I love the fact that you guys came together through a mutual friend and said, hey, we have a problem we want to solve. We want to be able to deliver care in the comfort of someone's home. We don't want them to have to go to clinics. Even though you call it Eminence Medical Clinic, it's a medical clinic that you deliver right into someone's home. And I know I threw out the terminology concierge medicine, and I want you to maybe build on how you may be very different from concierge, because I look at you and you have a lot of different verticals that you're in. I mean, your brochure and your website are very in depth in the stuff that you do, and I love that you have the reason to choose us, what your promise is. That's really exciting too, and maybe you can talk a little bit about that. So I am looking at you, Leah. So
All right.
I'm assuming you're going to take the mic.
Sure.
So let's go.
Okay. Typically, when people hear concierge, I'm going to assume it's what we hear from others is that they think about money. Okay. They're thinking about, oh, I got to pay up front. Why am I paying up front when I have insurance and I pay a lot of money for my insurance? For us, that is not what we're about. Concierge, when you mix it with concierge and Eminence, it's all about, let's say, a one-stop shop. We give you the opportunity to be able to talk to any provider. Actually, with our clinic or our practice, you are actually able to talk to a provider for whatever reasons. No, you don't get to, or you don't pay that extra $10,000 or whatever it is. There's no upfront costs, upfront fees. It's typically make an appointment, just like you would if you're going to Dr. Jojo and going to clinic, right? So if you think that, for example, if you have a flu-like symptoms, you want to be able to call your doctor? Sure, go ahead and call your doctor. Guess what? You're probably going to get that same day, same visit, whether it's a telemedicine or in clinic or a mobile visit. We're pretty accessible when it comes to that concierge terminology. Mm-hmm. You can pretty much be seen for anything and everything from, let's say, trigger point injections to weight loss to hormones, or Maybe mom's not feeling good. Her cognitive function has declined, and you're worried that something's going on, whether she may have a UTI or maybe there's something going on that she needs further workup. We are there. So pretty much we actually listen to the patients and the families and get that information of what it could be. So with the typical concierge, you guys get the voice and pretty much involved in the care.
Right.
We can tell you so many different things, but the way it works, as far as overall medical health, we want to include you. We want your voice to make it optimal.
For example, we just, recently saw a patient and we went over everything. She was a recent discharge from hospice, went over everything with her, but that at the end of everything we said, what's the first thing that you want to focus on? And she paused, and daughter paused and stared at us, and I said, that's probably never been asked of you before, right? And they had no idea how to respond because we said, this is your care now. We can guide you in these directions, but what do you want to start with? What's the most attainable or just most important thing to you for your health? What do you want to focus on?
It's pretty shocking when they do
especially when someone's coming off a hospice. I mean, now you have a different perspective on your life, and it's your journey, and we want you to be the author and write that script and help you live that journey the way you want to live it. So I love that. And it's not concierge because you don't have to pay buku bucks to be a part of Eminence.
No.
Not at all.
And you take all health plans?
Yes. And that's the thing that you asked earlier, why did we do this, or
Yes.
what makes this difference? We literally we want to see the whole picture. Our main focus obviously is the clientele that is missed pretty often. Okay. Do you want to
So
talk
we
about
go, in that sense, we go to private homes, we go to assisted facilities, we go to group homes. But the biggest thing for us that we love to do is go into the private home setting, because so many times patients are forgotten about because they're not in a facility, or their spouse or their loved one is currently taking care of them. And so then that spouse or loved one hasn't gone to the doctor either. And they're putting their healthcare needs to the side to take care of someone else, which is obviously the greatest thing ever, but we have to worry about them too. Someone always has to ask them, how are you doing though too?
That's what we do. I mean, it's interesting in the home care business. It's usually the adult child, usually the oldest daughter, who's directing us, and they're worried about dad because dad's got this diagnosis or injury, and we're always talking about mom. We're like, or whoever the partner is, have you really thought about them? And no, mom's doing okay. I'm not. You should be. You should be. They took the oath in sickness and health, and they aren't getting any outside help. So the stressors are really, really big. So
Yeah.
I like how you're really including the entire family unit.
We do. We like to say that even though, let's say dad's the patient, we always tell the family, but your whole family is now our patient. You can always still contact us for, simple questions or even just guidance. We know a lot of resources now being out in this field that we can always point you in a direction that may be helpful for you for other things.
Right.
We don't exclude them just because they're on paper. Let's say dad doesn't mean brother, sister, aren't included. We take that extra hand because there's a lot of emotional factors too with these kind of
100%.
patients. So we guide them no matter what. And then luckily they love the service and they join us later. They become a patient. So it's a good thing all the way around. I mean, some of these people don't even know what services are offered out there. It's very shocking that they don't know there's extra help, right? They only think that there's only insurance help. But, they need to be educated a little bit more, and that's what we're there for as well.
No, I love that. And I think you're seeing this now that you've started this practice for the last 5 years. I mean, we have 1/3 of our population 65 and older solo aging. That means they're aging alone. So I imagine there are times you're going to people's homes and they're widowed or widowers or never been married or divorced, and
Many times.
and there's nobody there advocating for them. So I mean, in essence, you end up becoming their advocate. You end up being their Sherpa, trying to guide them to the next resource or the best resource for what their needs are. It's an interesting landscape you're in, and I must tell you that I am all in on delivering care in the home. I think that is our future. We can't build enough hospitals. We can't build enough assisted living communities.
No.
When my mother suffered a major heart attack on January 2nd, 1985, that changed my life and my entire family's life with us being caregivers. Do you know in 1985, January 2nd, there was no such thing as an assisted living? There was no such thing as home care.
Wow.
I mean, it's amazing. This transformation has all happened in the last 35 to 40 years. And you are going down the right path. And there's so much more I want to ask you guys. So we're going to have to tell our listeners to pause, and I've got to pause. This is halftime at Health Futures. If you're just tuning in, stick around. We got 2 more segments. I've got Eminence Medical Clinic here in the studio. I've got Laura and Leah. L squared. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are in our second half here. I've got Eminence Medical Clinic here in the studio with me. I've got the co-owners here with me. I've got Laura and Leah here, and if you missed our first half, go to our website at cypresshomecare.com. Click on the media button. Right below that, you will find radio show, and you'll catch this one and many, many more. So we left off really talking about, your beginnings and the work that you guys do. I'm really, really fascinated. And as we talked about how people want to be in the home, and we talked about the number of solo agers, and the fact is today, with all of the advances we have in technology, especially telehealth, which it did exist before, but prior to COVID, we had an adoption rate of probably around 20%, and now we're in the 70s, maybe even encroaching on 80s, which I think is fascinating, because now we get practitioners getting a chance to see their patients in their home. And really, the home is where everything happens. And that's why I love the work we do in home care, because we're kind of like the tip of the spear, because we're the ones that see the changes in conditions before anyone else does. So the whole goal is to, as you said, I think it was you, Leah, where you said that, we want to prevent people from admitting. And, a lot of people talk about readmission, and in the home care space, the space I'm in, it's not necessarily readmission. It's we want to avoid admission, because we didn't necessarily get them from the hospital initially. They got a diagnosis, or they had a fall, or they just might be slipping, or they just recently became widowed or widowers, and the kids are like, holy crap, how's mom staying home alone? Or geez, I didn't know dad was that bad. All of these things come to roost, but we want to prevent an event from happening. So home is the place where everyone wants to be, and I know from looking at your brochure and your website, you supply a lot of great services right there in the home. So I'm curious, do you have the arsenal of people on your team, or I'm suspecting that you have a collaboration of partners that you are utilizing to deliver this care? And I'd love to know what you do to vet out those partners to make sure you have the best of the best out there.
We are really lucky to say that we collaborate with a lot of great resources, but like you said, we are picky. We want to make sure that who we're using is on the same page as us, with the same mindset, because of the fact that so many people are home and tend to get forgotten about and tend to get looked over because they're not in a big facility or they don't have 24/7 care. So that's why we work with partners that, have the same goals for the patients.
Mm-hmm.
Biggest thing for us is partners who communicate with us. We always tell them, we are never going to get bothered if you call us, if it's 5 a.m. or 9 p.m. and you just say, hey, I just have a question, so-and-so is looking a little this way. Please let us know. We are never going to say, don't call, this is not important. But the biggest thing for us is just knowing that our team of home health care, whether that be nurses, physical therapy, occupational therapy, home health aides, caregivers, everybody is so important when it comes to patient care, not just the medical side, but all the non-medical as well, because they are our extra set of eyes all the time. Mm-hmm. So yes, we can always, do what we can on the medical side, but when it comes to the patient who's comfortable with the people that are already in their home too, they're going to let them know of any changes, who then they will let us know of the changes. And that's why we feel like home care is so important on the medical standpoint and otherwise, because patients become comfortable in their home and they start telling our providers more, and they start opening up more, and they start trusting more, which means that we can be in there to help facilitate any next steps for their care.
I think Bob said the most important thing. It starts with you guys.
Right.
It from the very first time you step foot in the house. From the medical standpoint, honestly, we can't do anything without home care, and a lot more people in the general public needs to be more educated about it. Because without you guys, to be honest, it's not going to be good out there. There's going to be admissions. There's going to be a lot of falls. There's going to be a lot of icky stuff that our prevention won't work as well.
Right.
So as a team, I believe if it can be more out there, the general population as far as medical will be better.
I love how you said team. And that's really what I look at Eminence as a team. I mean, you have an arsenal of practitioners that you have available, that you have vetted out, that your collaborators, whether it be anything from wound care to psychiatric care, all of those things in between, you guys have that team in place. And I don't want to forget, and you lean in with this, and you guys were telling me this when you first came in, primary care. You guys are primary care, and I want our listeners to know that. So if I'm a person that is looking for a primary care person, Eminence is someone I would like to have as my primary care, right?
Yes.
Okay, I just want to make sure that I'm talking about the right things. And seriously, Eminence just makes so much sense to me. It really does. And, it's so far beyond primary care. So now you have primary care. That's your quarterback. That's the one that's coordinating all the care, getting ready for football season. Can you believe the Cardinals beat the Chiefs last week? I mean, really? I'm sorry. I got a little distracted. I mean, there's a sports network in here, and we are Money Radio, and we're Health Futures. So, nevertheless, you are the quarterback in coordinating that care for that individual.
Yeah, I mean, thing that, primary care, it's the first step, but, we go, as Leah talked about earlier, we go so beyond that in just different ways. Biggest thing for us is that continuity of care for patients. So, I mean, after they've allowed us into their home, nothing's worse than, seeing multiple different providers and having to tell your story all over again. We try to stick with one, at maximum 2 providers per patient. That way everybody knows what's going on. But that way the patient doesn't get frustrated either by having to repeat themselves over and over and over again, because they've already built trust with one person. To have someone else come in, they don't know them. They may not, tell them everything that's really going on, and then something could get missed. So we're big on just keeping everything as consistent as possible, because in the end, patients like consistency. They like consistency and they like trust.
Right. And I will tell you, I mean, the fact that you have so many people touching your patient files, there has to be like a really robust EMR or enterprise software solution that you're using. Is that right?
Yeah, for sure.
Yeah.
For sure.
So is that something equivalent to Epic? I know those guys, or Cerner.
We
or
have
is that
Next Gen.
Next Gen. Okay.
It's pretty much the same as every other EHR.
And every one of your providers that is providing care for one of your patients has that. So all the medical records are there.
Yes.
So very cool. What else have you done in terms of innovation and technology?
Well, I've just got into the AI dictation.
Ooh, no. Keep going. I love this.
So I'm very old school. I am the kind of person that will chart on paper and then chart on the computer on the EHR.
Yeah.
And then, the dictation with Dragon initiated, and I started using that. And then everyone's talking about AI and saying, Leah, what are you doing? Why is it taking you hours to chart? And then these guys are charting through AI within minutes. So I got into that, and it's kind of crazy fun. It's different. It's nice and quick.
It's nice and quick. And the way I look at it, Leah, is the fact that this is a tool that everyone should be using. I told everyone on my team.
It's actually really nice, because then you can actually spend more time with your patients. Because the biggest thing that we also really, really are avid about is we do not like it when, for example, our new providers, we'll automatically tell them, when you go see a patient, whether it's mobile or in clinic, you better not take a computer with you.
Do not just do this.
Yeah, because nowadays, most patients are so used to having a provider coming into the room and make a 2-second eye contact and say, all right, see you later, see you next year, or see you in a couple weeks. And then when you walk out, you're like, do they even know what color hair I have? So we're trying to refrain from that. And so this AI thing is actually pretty cool, because now you can actually pay 100% to your patient and then not stress out about your chart.
You have no idea how you're preaching my language. And I talk about this in home care too. And some of the things we're doing now is we are doing it in the home when we do the visits. And obviously we're in a one-way recording state, but we take it upon ourselves to fully disclose to the patient or client that we call, may we record this encounter. And we've never gotten a chance or never gotten a no. And we record that encounter for that very reason that you just described, so we can be more relational, more present, more authentic and real, and be in tune with what's going on rather than having our head down, trying to pound away on the keys or write down what we think we're hearing. This way we capture 100%.
Yeah, it's great.
It allows everyone just to have that extra eye contact too, because when you're trying to write and you're trying to type, you miss a lot.
Right. Well, you hear the music. I told you it goes fast. All right, so we have 3 segments down. We got 1 more to go. You know, I want to kind of dig into that last segment and ask, what's the future of Eminence? And where are you guys going? Because I'm sure you've got a plan. And if you're willing to share it, I would love to hear it. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Eminence Medical Clinic here in the studio with me. Got a little who taking us out again? Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, I've got Eminence Medical Clinic here in the studio with me. I've got Laura and Leah. They are both the co-owners. Leah's a nurse practitioner, and Laura is a speech therapist. I love that, speech pathology. So we have really talked a lot over these last 3 segments. And this segment here, I really want to focus in on really, one, what is it I want to really remember about Eminence Medical Clinic? You know, you have a great website here, and first of all, I want our listeners to know, define Eminence, go to eminence-medical.com. And the phone number I have is 480-795-8577. And I love how you have right up on your homepage, what is a mobile PCP? And that's what you guys do. You provide care in someone's home, which is really our future. And we should all be doing this now. This is the comfort that most people have. And you, like me in my practice, want to keep people out of the post and acute setting. You know, they call home care pre-acute, which is appropriate because we are in that pre-acute phase. So I'm looking at this. You can book online on your website. You have everything in here from urgent visits and very different services that you have available, even weight loss. I mean, you know, I'm looking at you, Leah. If you could just go through a listing of what are some of those services just real quickly so people can really understand it's not just PCP. And you talked about the collaborating partners as well.
We pretty much see anything and everything from all ages. So a lot of people think home services or mobile PCP is just for the elderly. And that's false. We're pretty much one of a kind to where we can see your 2-year-old if they're sick, or we can see your 102 grandma that's still pretty agile. And you know, and still able to do certain things. So we can pretty much do anything and everything, from either weight loss. Let's say you want to be seen at home because it's at the comfort of your home. We can do that. And there's nothing better to where you can be so comfortable with your primary care, to where you can open up, because there's so many times that it's hard to talk to your primary care. You can't get to the nitty gritty. Let's just say that. You can't open up to them. And sometimes when you don't open up to your primary care, we miss things. So it's nice to be able to do those kind of things, again, at home, whether it's weight loss, to where we can do medication management or diet modification. We can walk you step by step. We can do hormone therapy also. Again, it's at the comfort of your home. Pretty much we can do prevention treatment or chronic medication or chronic comorbidity management, from diabetes to congestive heart failure. We can do a lot of these treatments also with collaborating physicians with, as far as like cardiology goes. Anything else I'm missing? There's a lot there. I mean, we can go from A to Z.
Sure. And I look at urgent visits. I mean, how many times do, and it happened to me. I mean, I think I had the flu and I was feeling really, really horrible. And I ended up calling a company to do some IV therapy. Is that something you guys do too?
Yes, we do that as well. Again, pretty much if you can, if the things that can be done in an urgent care, like for example, IV therapy, we can bring that to your home.
Nice. So health plans, you're contracted with everyone. You're contracted with you can take Medicare.
Yes.
You can take Medicare Advantage plans.
Yes.
You are contracted with most of the MCOs here in town.
Yes, basically we take pretty much all major insurances
All
and
techs
state
too?
plans.
All techs.
Yes,
We're
we work
working
with all
on
techs.
we're working on more access plans just so that we can have access to more people and
Right.
patients can have more access to us. So the access we're still working with for all tech. We do take all techs, but we're working on every other plan.
So which plan are you taking presently?
Mercy Care, United Healthcare Community Plan, and then Arizona Complete Health.
Well, I mean, you've got pretty
That's
much.
for the access plans.
Yeah,
but
you have one more, Banner University.
Yeah,
That'll be the
Banner.
one.
Yeah, we're still working on that one. A lot of times
I'll
it's
help you.
just a lot of times it's just
Banner's a
because the
little
panel's
hard.
closed. We've tried and we're trying, but
Yeah.
it's just right now they're just not accepting more providers. But otherwise,
But you're not just a provider. I mean, seriously, you are not just your ordinary, provider. I mean, you are providing care in the home. You are going to save them money, and that's what these plans need to really understand.
and that's the thing too, is that we're big on taking insurance for that reason because everyone worked so hard for it.
Right.
Everyone paid into it. Let's use it in your home.
In your home. So when we enter the third segment, I talked a little bit about the future. So tell me where do you see, you're 5 years into this, and it's crazy that you started right before COVID, and how you got through COVID. You were doing home visits during COVID. That
It was
had
hard.
To be, that had to be
It
it was hard for all of us.
100%.
And that was the true test, by the way, to see if you guys were going to
If
make
we were
it.
going to make it, yes.
Yeah, if you got it through COVID, then this marriage was going to last.
Yeah. Talking about the future, there's no such thing as far as saying perfect, but
Yeah.
we want to be close to that perfect. We want the full circle. That means, what that means to me is basically we've got the best home care team. We've got the best home health team. We've got the best PT team to be able to communicate with them. We want to be able to give these services to the patient, again, at the comfort of their home. We don't want to miss a beat. So in the future, we want that full circle, that full communication with everybody that we work with 100 times better than what we are already. And then expand together.
Right, 100%.
And our biggest thing too is, we're always accepting new patients, and we always want to know that, like, how we can help with patients. And that's why, for that futuristic reason, or just what we're doing in the future, the goal is to continue growing, but we're not looking to just skyrocket out of nowhere and then patient care goes down the drain because of the fact that we've now just taken on everybody everywhere. But it's like, we will never say no to a patient, but we also, from a business standpoint, look at this as what's the best tactic? How do we get this going to do what we want to do next without losing out on patient care?
Well, you cover all the disciplines, and I guess my question was more outside the geography of Maricopa County, and I think I hear you loud and clear. Maricopa County is where you're focused. There's 4.6 million people that live here. There's plenty of business here for you all. So, I mean, why grow outside this geography? You've got a lot of work to do to really help our community rise up and be able to get the best type of care, best delivery of care in their home. So, as we get ready to close, is there a question I haven't asked or something that you would like to share with our listeners that we haven't really talked about already?
I think for me, in case anyone missed the beginning, is just that, because we're going into your homes, there's no checklist that, listeners have to think of to say, do I meet the standards of home
Do
care?
I qualify?
Right.
What has to be wrong with me to get a home visit? And the answer is really nothing. Home care is for everybody, and that's what we're trying to make known, that anybody can receive these services. You don't have to be elderly. You don't have to be sick. You don't have to have any underlying issues going on. You could just request a home visit.
Well, I will tell you, I'm looking at the website, Google reviews 5.0. That's impressive.
Isn't that awesome?
Yeah.
I love it. I love it. We take pride in that.
Well, you should. I mean, delivering exceptional care in the manner that you do is so, so important. You know, I really loved having you guys on the show, and I'm wanting to be a collaborator with you guys.
We would love that.
And like I said, Cameron said you need to meet Laura and Leah, and I'm so glad that I met you guys. And I hope that, you know, we've been able here today on Health Futures, been able to convey what you bring to our community. And I love the fact that you start with primary care, but there's all these other ancillary services that you do offer. So one more time for our listeners, if you want to reach out to Eminence Medical Clinic, you want to go to Eminence, EMINENCE-medical.com, or you want to call them at 480-795-8577. Laura, Leah, thank you so much for being here on Health Futures.
Thank you
for having us.
Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.